Glecaprevir and Pibrentasvir for 8 or 12 weeks in HCV genotype 1 or 3 infection. Definition: Glecaprevir and Pibrentasvir are direct-acting antiviral agents with pangenotypic activity and a high barrier to resistance. Hepatitis C virus genotypes 1 and 3 are together responsible for approximately 70% of an estimated 71 million to 8 million HCV infections worldwide.
Is a virus that hurts your liver. Your liver is one of the biggest organs in your body and performs lots of important jobs. The main function of the liver is to filter and break down toxins in your blood. This work is done by clusters of liver cells called hepatic lobules. As your blood passes through these lobules, they break down harmful substances like alcohol. They clean the blood by removing bacteria.
Application in medicine. Direct-acting antiviral agents have become the standard of care treatment for chronic HCV infections and show high rates of sustained virologic response in most HCV genotypes.
Now already has a treatment indication that was back in August of 2017. The unique aspect of it is it's approved at 8 weeks duration for a large population. So anybody who is treatment naive and non-cirrhotic, regardless of what their genotype is, gets 8 weeks of therapy is what's recommended. So that's the broadest indication for an 8-week regimen that we have. And because it's available for 8 weeks for a large proportion of the population and was priced relatively aggressively, let's face it, the price sometimes matters and what the options are for practitioners.
Patients with genotype 1 infection were randomly assigned in a 1-to-1 ratio to receive once daily Glecaprevir Pibrentasvir for either 8 or 12 weeks. Patients with genotype 3 infection were randomly assigned in a 2-to-1 ratio to receive 12 weeks of treatment with either Glecaprevir Pibrentasvir. Additional patients with genotype 3 infection were subsequently enrolled and non-randomly assigned to receive 8 weeks of treatment with Glecaprevir and Pibrentasvir. The primary endpoint was the rate of sustained virologic response 12 weeks after the end of treatment. Applied in Ecuador. Pros and cons. Pros. Glecaprevir plus Pibrentasvir was well tolerated and achieved high sustained virologic response rates in HCV genotypes 1 to 6 infects patients without cirrhosis following 8 or 12 weeks treatment duration. Cons. 3 patients discontinued treatment due to adverse events. Most events were mild in severity.
Hepatitis C has been getting a lot of press recently because we have a lot of new medications coming out for hepatitis C. The problem with hepatitis C long term, just like with any hepatitis, is if you have active inflammation in the liver, the problem with that inflammation is eventually it can turn into scar tissue, and that's what cirrhosis is excessive scarring in your liver. And then so hepatitis over time can lead to excessive scarring in your liver and even cirrhosis. So I quote patients, if they are acutely exposed to hepatitis C, in general they have about an 80% chance of developing a chronic infection, and out of that 80% that has developed a chronic infection, around 1 in 4 will potentially develop cirrhosis over their lifetime. And then once they develop cirrhosis, they have about a 3 to 4% chance per year of getting worse or decompensating, where the only thing that could potentially help them in the future is a liver transplant. There is a treatment
Applied in Ecuador. Currently, there is no Glecaprevir Pibrentasvir treatment in Ecuador. Conclusion. Treatment with Glecaprevir and Pibrentasvir for 8 weeks yielded rates of sustained virologic response at 12 weeks of 99% and 95% in patients without cirrhosis who had HCV genotype 1 infection or genotype 3 infection, respectively, which indicated that 8 weeks of treatment with Glecaprevir and Pibrentasvir an efficacious treatment option for HCV genotype 1 or 3 infection.
My name is Kathleen Burnock. I'm the lead clinician for the Hep C treatment program at Bedford-Stuyvesant Family Health Center. Working here, I've come to realize that there's far more Hep C in our community than I had thought when I first began. And many people that I've tested here had no clue that they had Hep C when I tested them. And quite a number of them didn't have any known risk factors that they could think of. And this is especially true amongst the baby boomer population, people age 49 to 50 and older that are at risk for Hep C without known risk factors. People think of just drug use when they think of Hep C. And I won't lie, IV drug use is the leading risk factor for Hep C. Almost 80% of people that have ever injected drugs in New York City have hepatitis C. And now actually there's a cure for Hep C. So it's more important that you come in to know your status because Hep C can be cured. And Hep C does not just cause liver disease, it causes all sorts of medical conditions, including increased risk of heart disease, diabetes, certain cancers like thyroid cancer, prostate cancer. So now we can cure it. So I encourage everyone in the community, if you don't know your status or if you do have Hep C, come in to see us. We'll work with you through from the beginning to the end and make sure that we treat you and cure you.